I'm Tiana.
And I'm Felicia.
I'm Shayla.
And I'm Kivana, and this is our pharmacology video project on asthma. Our pharmacology concept is gas exchange. The disease we'll be discussing is bronchial asthma. It is a type of chronic obstructive pulmonary disease. It is when the patient experiences periods of bronchospasms, which leads to wheezing and difficulty breathing. A bronchospasm is when the tissues in the lungs are exposed to factors that stimulate a bronchoconstriction response.
Now let's meet our patient. Ty is an 11-year-old girl who was diagnosed with asthma when she was 9 years old and was prescribed albuterol PRN for her asthma attacks. She has allergies to pollen and grass, and her family recently bought a new dog and gave her the responsibility of taking care of it. She has recently noticed that she has been using her albuterol inhaler more than usual. After a nap with her dog, Ty was playing outside when she noticed that her chest started to feel tight and she began wheezing. When she told her mom was concerned and decided to bring her to the hospital. When meeting with the nurse, her mom informed the nurse that she has been using her albuterol every day and is having symptoms more often at night. When Ty is asked to describe her attacks, she tells the nurse that she feels like her chest is tight and that she cannot catch her breath.
The nurse knows that the chief complaint is tightness in the chest and shortness of breath. The nurse then performs her physical assessment prior to intervening. The nurse gathers the vitals and uses the pulse oximetry to measure Ty's O2 levels. Before auscultation, the nurse inspects the chest, neck for the use of accessory muscles on inspiration and notes that Ty appears to have labored breathing and pursed lips. The nurse then listens to the lungs for adventitious breath sounds while assessing the quality of respirations. The nurse notes that Ty is wheezing. For further testing, the nurse uses the spirometry test to measure the amount of air that is forcefully exhaled after a full inspiration. The nurse notes that her FEV1 is around 60%. After her assessment, the nurse reaches out to the healthcare provider for the appropriate interventions. The healthcare provider prescribes 2 more medications to Ty and diagnoses her with bronchial asthma attacks.
The provider prescribed a drug administration that consists of ProAir as a rescue inhaler, Atrovent as a metered dose inhaler, and QVAR Readyhaler in dry powder form. Drug interactions include the triggering of asthma attacks by drugs such as aspirins, NSAIDs, and beta-adrenergic blockers. The provider wants to continue the administration of albuterol, specifically ProAir, a bronchodilator to relax the airways, increasing airflow by acting as a beta-2 agonist. Side effects include tachycardia, tremor, insomnia, and difficulty sleeping. Adverse reactions include palpitations, dysrhythmia, angioedema, bronchospasm, and Stevens-Johnson syndrome. Patient teaching includes instruction to shake it before you take it, do not take at bedtime, and to take 2 to 4 puffs every 20 minutes during a severe asthma attack, and to notify the healthcare provider if it does not work after 3 rounds. Metered dose inhaler teaching includes instructing the client to exhale completely before inhaling the drug and to hold their breath for 10 seconds so that the medication gets deep into the airways. It is important to note that if the medication is effective, the nurse should expect high oxygen saturation of 90 and higher. Also, normal findings after treatment include increased productive cough and reports of decreased anxiety.
The second drug that the healthcare provider prescribed to the patient is ipratropium. The brand name is Atrovent and is an anticholinergic. This anticholinergic works by inhibiting cholinergic receptors in the bronchial smooth muscle. When albuterol is not effective in opening the airways, ipratropium is given to dilate the airways, decrease bronchial secretions, and dry out the mucus that is trapped inside. Some of the common side effects and adverse reactions are dry mouth, anuria, dizziness, headache, epistaxis, nervousness, blurred vision, bronchospasm, GI irritation, and hypotension. The nurse would teach the patient how to utilize the metered dose inhaler and to use 1 to 2 inhalations every 6 hours as needed. They would also instruct the patient to rinse out the metered dose inhaler 1 to 2 times a week with warm water. The nurse would advise the patient to rinse her mouth out after using the inhaler to minimize the probability of getting dry mouth and caution the patient not to exceed 12 doses within a 24-hour period, and to notify her healthcare provider if her symptoms do not improve or worsen. The third drug prescribed to Ty is beclomethasone, a corticosteroid. The brand name for this steroid is Q-Var Ready-Haler, a dry powder inhaler used as a maintenance treatment prophylactically. This steroid is a slow-acting steroid that acts as an anti-inflammatory to decrease the frequency and severity of asthma attacks and is given twice daily. Common side effects and adverse reactions are hypertension, headache, agitation, restlessness, insomnia, dysphonia, hoarseness, hyperglycemia, sodium retention, nasal congestion, dry mouth, immune system depression, and steroid psychosis. The nurse would be sure to educate the patient to take this medication twice daily and to allow 5 minutes to pass after administration of the previous bronchodilator, Atrovent, before taking Q-Var Ready-Haler. Again, teaching the patient to wash the mouth after administration and to never swallow the water in their mouth after rinsing. Unlike the bronchodilator, the corticosteroid inhaler needs to be washed each day after every use with warm water. This medication is only given short-term and is not to be used as a rescue inhaler due to its slow-acting characteristics.
From our group to yours,
Thanks for watching.